All right, welcome everyone. Thank you for joining us this evening. To begin, I'll hand it over to Dr. Fernando Rosario Ortiz to give us an introduction on the Environmental Justice Series.
Good afternoon, everyone. On behalf of the Environmental Engineering Program, I'd like to welcome you to the second in our Environmental Justice Seminar Series. These seminars are an important component in our mission to train our students, in this case by bringing excellent speakers that can share their work with other work in the area of environmental justice. Today's speaker is Professor Adrienne Katner, someone that I've known for close to 20 years now from our time at UCLA. And I'm excited to have her join us today and looking forward to her talk. I also want to thank the students for organizing this event, Abigail, Julia, Cole, and others, and also Professor Jenna Milford for all their work putting this event together. And with that, I'll send it back to Anthony.
Thank you, Professor. Once again, I'd like to welcome everyone to our seminar this evening featuring Dr. Adrienne Katner. Dr. Katner is an associate professor in environmental and occupational health at the Louisiana State University School of Public Health, and she holds a doctorate of the environment from UCLA. Her research ranges from uncovering gaps in drinking water regulations, such as the lead and copper rule, reducing water contaminant exposures for public health guidelines, and providing resources and support for small water systems in rural communities. As recent case studies throughout the US and the world have taught us, it is vital for environmental engineers and scientists to be able to communicate clearly and effectively to stakeholders such as government officials, utilities, and of course, residents or consumers. I'm very excited on behalf of all SU Boulder environmental engineering students this evening to learn more about investigating cause and awareness of water contamination in New Orleans. We'll be monitoring the Q&A throughout the talk, and we'll save time at the end for additional questions. So please type any questions you may have into the Q&A on Zoom. And thank you and welcome, Dr. Katner.
Thanks, guys. Thanks for having me. I appreciate you reaching out and being interested in my work. So I'm an assistant professor at LSU School of Public Health. And we are sort of in the midst of a series of hurricanes and storms that have struck the Louisiana coast. We've had one tropical storm already, 2 hurricanes. We've had some records broken, and I think we have another one that's sort of forming. But what is happening is that these are impacting the availability of clean water, especially in rural areas along the coast. So a lot of the news lately in Louisiana has been on the people who in these areas who are impacted, who can't access drinking water. And when I say impacted, I mean miles and miles of swaths of land are gone. Whole houses are gone. And so stores, the selling bottled water are not available. So there is a lot of back and forth traffic. So the state of the United States drinking water is not great. I think we all are aware of that. America got a grade of D for its drinking water infrastructure. And the people who are primarily worried about drinking water are low-income populations and minorities, non-whites. They have shown the most concern about their water quality. Now, one thing that happens when water quality is at risk are rising rates of water. And we've seen this trend happening in the last few years. One study from 2007 said that about 1/3 of Americans are at risk of losing their water access completely by 2022 due to the cost of water alone. And in Detroit, certainly we have seen this already. 50,000 Detroit homes lost service since 2014, probably more by now. So one of the things I look at, because Louisiana is a very rural area, is well water, because it's not well regulated. So because we're sort of in the center of, Hurricane Central here, and we are feeling the impacts of climate change. We're feeling the impacts of coastal land loss, of subsidence, saltwater infiltration, hurricanes, storms, floods, inland floods, river flooding, all kinds of things. So we've been hit hard. So we have written up a series of NSF rapid grants to kind of evaluate and study the impacts of these floods and storms on well water communities. So the reason I'm interested in well water communities is because we have a long history of racism in the South, and we have had discriminatory practices that have left a lot of the minority and low-income communities sort of off or unconnected to the grid, unconnected to the community water systems. And so they've been left to their own devices to get their own water supplies. So in 2016, we had a historic flood. It's called the Great Louisiana Flood, 2016. And I had just bought a house in Livingston Parish, the area that's circled here. 75% of all the homes were considered a total loss in that one parish or county. And everybody in my area relied on water wells. So we looked at a bunch of things, but one of the things we looked at were the FEMA flood insurance maps. What we found was that only about 22% of the residents who flooded were actually required to have flood insurance. That is, they actually lived in zones that required flood insurance. And of our study participants, about 27% were in low flood risk zones actually flooded. So there was an issue with the flood rate maps. And part of that is due to political pressure being placed on FEMA to modify flood risk maps in order to make these areas affordable to low-income communities. If you live in a high-risk flood zone, you're going to be paying really high flood insurance. And so what has happened down here in Louisiana is politicians have used their power to get our rates down. But what that means is there's no money when your home floods. So when you're on a drinking water source, so this was data from Louisiana. We looked at people who were on drinking water wells, and we were interested in their water quality after the flood and whether or not they were drinking it. We evaluated about 263 homes, well users. About 44% were drinking it without any kind of treatment whatsoever. And the surprising thing about that was almost half had some total coliform presence, viable total coliform, and about 13% had E. coli, but they were drinking it without treatment. And to understand why they were doing that, the area that was impacted in Louisiana was massive, and there were no stores anywhere near. So you would have had to, in some areas, you would have had to take a boat to get to land, to then get a car to get to a store. And that might take 2 or 3 hours. So it was very difficult to access anything in these areas. So the residents were left to themselves, to their own devices. And so one of the things I kept hearing was, I kept asking, well, do you know how to treat your well? Yeah. You just get a gallon of bleach and you pour it down the well and ta-da. Well, it's not that simple. And we did do some samples of people's well water quality shortly after they did this procedure. They shock chlorinated their wells. And we weren't that surprised, but a little, to find that those who did disinfect within 2 weeks still had detectable total coliform or E. coli. About 26% that disinfected had total coliform, and about 11% had E. coli. Now, this was a very small number of people who disinfected, about 19, but it was very concerning. And we tried to probe into maybe why it didn't work. One of the things we found is a lot of people didn't know their well depth. And so they didn't know what volume of water they were dealing with. Some of these people had very, very deep wells, about 300 feet or more. And because they didn't know the volume of well water, they really weren't attuned to what is the proper amount of chlorine to go in there. So that was some problems after the flood. There's other water quality problems and issues in Louisiana. You guys have heard of Flint, and lead is ubiquitous. It's in pretty much all US housing stock that has any kind of lead-bearing plumbing. Even brass faucet fixtures today have some amount of lead that's still allowable. About in 2015, about 17.6 million Americans were served by water systems that violated the lead and copper rule. Now, this is amazing because when I tell you how you need to violate the lead and copper rule, you'll be surprised. So why do we care about that? Well, lead is one of the oldest known poisons out there. We've known for thousands of years that lead was bad. And lately, in the last few decades, we've been learning about the low dose impacts of lead. There is no safe level of lead. Scientists have acknowledged this. It affects pretty much everything in the body, and effects can be permanent. And we can also store it in our bones. And as we age, when our bones start breaking down, we can release it back into our blood system. And now we're learning about early life exposures and those later life impacts due to those early life exposures in terms of cognitive health, dementia, Alzheimer's, things like that. So we've learned that a child who is highly exposed to lead we see a reduced brain volume. And so there's neuronal connections that are being affected by lead in the early development of the brain. And that's why we really care about low dose exposures to lead. We're also concerned because the relationship between lead and cognitive factors like IQ is curvilinear. And what that means is that the lower exposures can have a steeper effect on IQ rate of decrease versus a higher exposure. It's almost like it saturates out. So those really low doses can really impact the child's brain. So we all know what happened with Flint. I'm not going to go into that, but we also probably remember, if we were attuned to the news at that time, that the residents were being told it's only an iron issue, which is totally safe. And in some respects, they're correct. You know, iron is a nutrient. We all need iron. And that was totally safe. A lot of people don't realize, but Flint was compliant with EPA regulations, which in this case was the lead and copper rule. So that lead and copper rule requires that utilities monitor tap samples. If the 90th percentile of their samples has a lead level that exceeds an action level of 15 parts per billion, then some kind of utility action is then required. What a lot of people don't know, though, is this action level is not a health-based value. This was an amount that was determined back in the early 90s based on the proportion of systems they thought would exceed that level. So what that tells us is that 10% of the samples or homes that utility will collect water from is allowed to have any level of lead whatsoever. It can have hazardous waste levels of lead, but as long as 10% it doesn't exceed that amount, it is compliant with the lead and copper rule. So EPA has long known this and has tried to communicate this fact that compliance with the lead and copper rule doesn't guarantee or even imply that all individuals in a city are protected from lead and water hazards. The disconnect came between the scientists, the regulators, the engineers, and the public health practitioners. So public health practitioners just assumed, oh, if you meet the lead and copper rule, we don't need to sample a child who has lead poisoning. We don't need to sample their tap water because it's in compliance. And this has been going on for decades, where the impact of water on lead levels in children, especially bottle-fed children, which can be the biggest impact, is diminished or is not considered important. We also really didn't understand at the time that they actually had cheated on their lead monitoring. That only came out later. And this is actually a common thing that utilities will do. They'll go back and resample the very high lead levels. And sometimes they'll take it out because it'll be For some reason, it'll be determined not compliant. And then, wow, all of a sudden they passed. And this is what happened in New Orleans after Katrina, which I'll go into later. Another reason why utilities can meet the LCR is also the way the sample is collected. So pre-flushing the tap before the sample is collected, removing the aerator before it's collected, collecting the water at very low flow. All of these things are designed to minimize the collection of lead, the detection of lead in the lab. So the Guardian did a study of cities, 81 cities east of the Mississippi River, and they found that 41% collected water in ways that can underestimate lead. So you guys asked me to speak to you about the canons, the fundamental canons of engineers, and these are the 6 canons here. And one that I wanted to point out here, but I'm going to point out all of them today: avoid deceptive acts. And this practice of intentionally sampling, collecting samples in a way that will minimize the detection of something is a deceptive act. Now, the big issue with Flint was they didn't have corrosion control treatment, which is a requirement in mid-sized to larger cities. The problem, the reason they didn't use it was because they were under a state financial emergency manager and he canceled it. Now, he knows nothing about water treatment. So this gets to our next canon: perform services only in the areas of your competence. And if someone tells you to do something and you know that's against the law or it's not good in treatment, you have to make a stand. So what happened when they didn't use corrosion control was you saw a lot of lead, you saw a lot of iron, and you also saw some biofilms that were basically broken down and resuspended in the water. So you got very dirty water. Now, one of the things that iron is good for, Legionella is an iron loving bacteria. And because of that, it can help propagate its growth. When they switched their water supply, what they saw was a 143% increase in Legionnaire's disease. Now, this wasn't detected right away because hospitals don't do a really good job of actually determining whether you have Legionnaires. Usually elderly people will get it in the hospital. They'll say it's pneumonia. It's usually not tested for beyond that. And it's also something that you are exposed to through inhalation, not consumption. But hot tubs, humidifiers, misters, neti pots, if anyone uses neti pots out there, one of the things we know is going to happen with climate change is people are going to have a lot more allergies and problems with breathing, respiratory issues. I have that. If you use these neti pots and you don't have autoclaved or sterile water, you're going to use your tap. And that's a frequent thing. In New Orleans, what we've been seeing in the summers, high rates of amoeba outbreaks, which we'll talk about in a second, but also we start to see Legionnaire outbreaks. Why this is, we're still trying to figure it out. But the issue with the Legionnaires is, and this is probably an undercount, but we estimated that there's about 12 deaths from Flint due to that. And this is deaths. So unlike the impact that it will have on children, which is lifelong, these are deaths. Now, a lot of these things were uncovered by officials at the EPA who were subordinate. The higher level officials at the district and federal EPAs tried to, in a way, cover it up, as did the state water officials. It took some citizens, it took some very brave subordinate EPA officials, and it took some academia to identify it and to bring it out in the open. And this is a very brave and difficult thing to do because, as you'll see, if you know anything about the history of scientists, Galileo, Rachel Carson, there is a whole history of scientists who are made to feel bad for coming out and doing these things that they really believe wholeheartedly is their obligation to do. And this brings us to another canon of engineers, and that's to conduct yourself honorably, responsibly, ethically, and lawfully, so as to enhance the honor, reputation, and usefulness of your profession. This is important. As scientists, we rely on our trust. If we lose the public's trust, if we lie or deceive or not represent them, or we don't stand up for the truth, we don't stand up for science. And sometimes science is a moving target, right? So we're learning about COVID. Our ideas are changing, but we have to be bold enough to come out and say, we were wrong, now we know this, now we do this. But always maintain that trust, because once you lose that trust, you've lost a lot already. So you see this cycle of decline. We're seeing it in New Orleans. We're seeing it in small rural towns throughout Louisiana, where there's no corrosion control. You see these metals leaching into the water. Sometimes the iron will deplete the chlorine residual, and it also can be a nutrient for some pathogens. Those bacteria will grow. They'll do a chlorine burn. That leads to increase in disinfection byproducts, more corrosivity, infrastructure will break down, and on and on. Now, this brings me to Louisiana. We received a D+, which is, wow, I think we improved our grade. This is back in 2017. We're used to failing everything. We're the most obese, we're the least ethical, least transparent, on and on. We win. So there's a small town in northern Louisiana called St. Joseph. I'd never heard about it. It's a very tiny town. They were meeting the lead action level, but they had very high levels of iron. And again, it's a nutrient. Now, corrosion control is not required for very small utilities, and this is a very small town. Filters don't work because they'll get clogged, so they don't really have an affordable solution. They were also getting a lot of boil water advisories, which tells me that there was a lot of bacterial detections in their water. Now, St. Joseph shared a lot of commonalities with Flint. There had been a population decline, so this was an agricultural town. Agriculture had busted. We started getting our agriculture from larger communities and developing nations. Very small population, mostly minority, very, very low income. Very high water bill, very high water bill. So because the population was leaving, all of a sudden you have this drinking water infrastructure that's not being used. And unlike other infrastructure, like bridges, when you don't use drinking water infrastructure, it's liable to break down and corrode. And so there was constant leaks, constant boil water alerts, and thus higher water bills. We also had a situation where we saw in Flint an increase in kids with elevated lead from about 2 to 4%. Well, in this parish where St. Joseph is located, we had a normal elevated lead, blood lead level rate for children of 14%. St. Joseph is very similar to Flint in other ways, so no corrosion control. They were told the water was safe. Unlike Flint, where they actually had some action after a year, St. Joseph had to wait about 10 years before the government responded. They also had a fiscal administrator. Thus, the people had no political voice. And it wasn't until there was independent monitoring by scientists and media attention that got things starting to change. Now, similarly to Flint, what we heard from our state health officer was that these complaints have arisen because of Flint. It's not a lead issue, it's an iron issue, and that's not a health issue. But what he failed to mention was that history of drinking water violations in St. Joseph was very long, including the failure to monitor the chlorine, to monitor coliform. There was coliform detections, lack of public notice, on and on, consistently. This brings me to my next canon. Issue public statements in an objective and truthful manner. There was also corruption. So the state was actually going to give money to St. Joseph to fix its drinking water infrastructure, but they couldn't release the money because the state hadn't released its audit, its financial audit. And what they found out afterwards was the mayor wouldn't release it because he was pocketing the money and awarding contracts to his family. So this is Louisiana, and this is a very common thing, corruption. So the people took it into their own hands to see if they could get help from the White House, and they petitioned the White House. The problem with that is you need about 100,000 signatures if you're going to petition the White House to get attention. And it's a very small town, about 1,000 people. They didn't meet the signature requirement. Amazingly, they got 13,000 signatures, but that still didn't meet it. And so basically they were pushed down. So they contacted me. They heard about my work in New Orleans on lead, and they wanted to see if I could take samples from their water. So I just tested 3 sites, did a few samples at each site. And there was one site that had pretty concerning water lead levels, enough for me to contact the Louisiana Department of Health and say, hey, I think you need to look into this issue. They didn't listen. It took the citizens to come before the state legislature before a state legislator actually contacted LDH and said, hey, what are you doing about this? And the state health officer then called me and said, hey, why didn't you tell us about this? And I said, I did, but you didn't do anything. And that's what got the ball rolling. And of course, the media helped along with that too. So the state did an investigation. I think they sampled between 400 and 500 homes. 22% exceeded the lead action level. That violated automatically the lead and copper rule requirements. Maximum, not as high as Flint, but 1,810 parts per billion. And again, the non-health-based action level is 15. And this is what they were dealing with for 10 years. So they got a Christmas present a couple years after all of this was kind of thrown into the media. And they finally declared a public health emergency in St. Joseph and said, we're going to take care of this. Now, this was one town, and they had to then go back into their records, and they estimated that there was about 400 struggling rural utilities that were having similar problems. And what we see in Louisiana is this cycle of deindustrialization, poverty, population flight, reduced tax base, there's no money for repairs, the system stagnates, there's water contamination, increased water rates, and disproportionate socioeconomic and health burdens. And this is the cycle that we're seeing in a lot of our rural towns down here. Enterprise is just another one of these towns that I tested. And we're seeing the same similar pattern, very high levels of iron, very high levels of lead. They'll might detect some bacteria. They'll do a chlorine burn. That'll go pretty fast. When I got there, a few days after they detected bacteria, I couldn't detect any chlorine in about 29% of the 21 homes that I sampled. But I did detect very high disinfection byproducts. Again, one of the residents said, it's like we're in a third world country. So this triggered an investigation of the drinking water program in Louisiana. And several things came out of that. They learned that they didn't issue violations for some of the unperformed public notifications. They didn't always follow up to see if the utility complied. So there was a lot of issues. So this is another canon of engineers hold paramount the safety, health, and welfare of the public. Some other things came out of this. The governor started a rural water infrastructure committee, and they started to prioritize distressed water systems and search for funding to help them. Now, if you want to study environmental justice, come to Louisiana. This is where it's happening. This is one of the most widely known corrupt states in the country. And environmental racism is everywhere, unfortunately. EPA Inspector General found in 2011 that Louisiana was among the worst states at enforcing federal clean water, air, water, and hazardous waste laws. And they also concluded that by saying that this weak enforcement might be driven by a culture in which the state agency is expected to protect industry. And indeed, the Louisiana Department of Environmental Quality has two roles. One is to protect the environment and people, and the second is to facilitate and help industry meet those regulations. So they have an economic role and an environmental quality role, which is sort of that conflicting. If we needed any more documentation about Louisiana, the state legislative performance audit found that DEQ may not be fully protecting the health and environmental resources of the state, that industries that invest in compliance actually operate at a disadvantage because it's cheaper to violate the regulations than it is to try to come into compliance with it. And then an EPA Office of Inspector General in 2002 found that EPA could not assure the public that Louisiana was protecting the environment. Environmental justice is rampant here. If you've ever seen EJ Screen or gone online to EPA's EJ Screen, you can see it. It's very evident from these maps that toxic releases, Superfund sites, brownfields are primarily placed in largely minority communities. These are the dark red areas. You see it in New Orleans, you see it along the industrial corridor, which is the area between Baton Rouge and New Orleans. And you see this area of minorities has been pretty much infiltrated by these industries because there is no political power. There is no political voice to prevent it from happening. So a classic EJ community is primarily minority or low income. They're subject to disproportionate impacts from one or more environmental hazard. They're also subject to disparate implementation of oversight and protections and requirements. So there is also a disparate implementation of environmental oversight. And they're also excluded from the decision-making process. And this is critical. One thing that came out in the Flint report was that it's not about intent. So it's not necessarily, you don't have to have very racist people on staff. It's about the outcome. It's about the results. If they weren't given equal protection and meaningful participation, then it's an environmental injustice. So the Center for Public Integrity did an evaluation of US EPA's environmental justice program back in 2016. This was 22 years after it had been formed in 1996. And what they found was amazing. They found that there was no formal finding of discrimination in the whole 22 years of this program's history. This is the environmental justice program in the EPA. No formal finding of discrimination. No discrimination had occurred. And there's other reports. The Government Accountability Office said EPA needs to pay more attention to environmental justice. EPA's Office of Inspector General reports EPA needs to consistently implement the intent of the executive order on environmental justice. Senate hearings. There's all kinds of the wealth of information that you can find on the government's website, hopefully. Some of it's been pulled. Now in Louisiana, we had about 14 complaints since 1996. Only 4 were accepted for review. Some were rejected. Some were pushed out because they were no longer timely. And basically, none of these have gotten anywhere. One of the residents said, all of these complaints to EPA have gotten us nothing, 0. This brings us back to another canon, hold paramount the safety, health, and welfare of the public. Now, a lot of lawyers say EPA has the authority to fine these companies, to find that they are in violation of environmental justice rules, but they're not exercising that authority. So let's get back to New Orleans. After Katrina, over half of our drinking water distribution system was damaged. One of the things that we got from FEMA was a lot of money to redo a lot of the infrastructure, the electrical, the water, everything. When the utility is non-compliant, sometimes it's required to replace the city's side of the lead service line. Now, some cities own an entire service line from the home to the main in the middle of the street. Some cities own part of the service line from the main in the street to the water meter. And then the consumer owns the other side. When a utility replaces it or is required to replace it or replaces it because of some routine repair, sometimes they only do what's called a partial lead service line replacement. Full replacements can be very expensive. Sometimes your lead service line might be under a tree. You've got to take that out. It's very expensive. It can be $10,000 or more. But what's important here is that it's frequently done, either because of a violation or because of routine repairs. Now, the problem with that is that the EPA Science Advisory Board found in 2011 that PLSLRs, partials, can increase water lead for weeks to years, and that the lead levels are high enough to be a concern from a human health standpoint. And it's also an environmental justice issue, because unless you replace both sides of the line at the same time, you're going to have that partial impact. You're going to have the dislodging of the scale that's along, that lines the pipe, and that gets into and mobilized into your premise plumbing, and then serves as a sort of endogenous source of lead for years to come. If you are not rich and can't afford to replace the other side, you get a partial. If you're rich and you can afford to replace all of it, you'll get a full replacement, and you'll be in a much better position health-wise. So after Katrina, we did 16,000 partials across the city, not because we were in violation, because we got the money to do an overhaul of our system. What that did, and what I knew it would do, it would increase the water lead levels. So even after a 3-minute flush, I found water lead levels as high as 226 parts per billion. Flushing only, there was one study that looked at partials in New Orleans and found that even after 2 weeks, the lead didn't stabilize. And that's as far as the study went. It didn't go past 2 weeks. So I brought this to the attention of the Office of Inspector General, and they were studying something else about the Sewage and Water Board. They put it down and they said, this is really important. We have to report on this and we have to figure this out. And what they came out with very shortly after was the city and the Sewage and Water Board had not alerted residents to any risks from these partials, and they weren't required to. Under the Consumer Competence rule, they weren't required to, and under the lead and copper rule, unless they were in violation of the lead and copper rule, and they weren't. So there was no requirement in the lead and copper rule at that time. And what they said is that because of that, New Orleans residents may be or may have been unknowingly exposed to elevated levels of lead in their drinking water. Now, the report that they were working on at the time, they picked up again right after that report came out. And what happened then was shocking. What they found was, what they did was an investigation of the utility, the water utility, in terms of how they sampled and how they came into compliance with the lead and copper rule. And what BuzzFeed had found out was that the city failed to test for lead in the city's highest risk homes and covered it up for years. And then the report was buried. I kept asking year after year, where's the report? Why hasn't it come out yet? What we found in the report, once BuzzFeed got the report from the Inspector General, was that they had not verified that the sites that they were sampled had lead service line, which is a requirement. They were sampling in ways which can underdetect lead. And they were also removing high lead homes from the pool that biased the samples downward. And basically the Inspector General, who had retired after this report, before it came out, said this organization, the Sewage and Water Board, is riddled with corruption. And he said it's unethical to hide that report. The people of New Orleans know nothing about it. And still to this day, many New Orleanians don't know about this report. So, you know, a lot of canons were broken at that point. And it's very important, again, as an engineer, and maintain the trust of the public. So I'm running out of time, but what I wanted to focus on, part of this lecture on, was developing consumer-centric initiatives to empower citizens to take control of their drinking water quality. And this has really become possible in the last decade or so, because now we have these very low-cost water testing apps. We have low-cost water treatment filters. We are empowering them by telling them how to find the data. We are also collecting data through crowdsourced mechanisms, training the community, giving them toolkits for community action, doing citizen science, doing community-based research to answer questions of concern to them, and also educating students through these problem-based interdisciplinary hands-on projects. So some of the things we're engaged in, we're developing a citizen empowerment website with a citizen's guide that gives communities information about how to find their drinking water data, what it means, what is the best water treatment system, what are the best water testing kits out there. We also got a grant to do environmental education in elementary and high school. So we developed a bunch of lesson plans that were centered around Flint as a case study, but also created a project for people to go out into their communities, figure out what was the environmental issue of concern to their community, and then identify the hazard, evaluate exposures, evaluate risks, and then communicate that risk or develop policies to then promote and propose to politicians to address that. So this is some of the lesson plans are just, you know, how do you know if your water is corrosive? This one was just putting a basic nail into your drinking water and seeing if it corroded. So these lesson plans are available online. We also expanded the project because people were interested in air quality. And so we started to do some air monitoring around the Interstate 10, which was built right through the Treme neighborhood, which was an old mulatto neighborhood, very culturally rich area. Jazz was born, and it was really decimated when the interstate was basically built right in the middle of it. So we brought some kids out, we did some air monitoring, we did some water monitoring. They took a balloon up to see what the traffic was like. And they wrote a book about their experiences that we then gave to politicians, to residents to sort of digest. So we're testing all these educational interventions to see what impact it has. We know that we've alerted the public. We know that the public is interested in these things. And our students are taking their issues to the highest authorities, to the mayor. This is one of our kids taking his letter, his policy recommendations to the New Orleans mayor, Mayor Cantrell. We're developing online educational tools and resources. We're testing at-home test kits to see which ones are the best. We're evaluating lead filters to see which ones are the best. We are crowdsourcing data to find out where lead service lines are throughout the country. We are accessing and evaluating resource accessibility for private well users in different parts of the country. We're developing educational materials. So in the case of the water disinfection, we realized that a lot of protocols out there are inconsistent and don't even spell out some of the most important steps. And so we went through all of those and evaluated and created what we thought was the perfect, this is how you disinfect your well. And then we're giving them materials on how to treat, how to identify a filter, what to look for on the filter, things like that. So another thing that we're doing is we're working with the American Geophysical Union Thriving Earth Exchange Program to do community research. So these are actually helping the community address their research questions. And so they came to me with some of their concerns about the impacts of the air quality around the interstate on their health. And so we have worked with the community to investigate this, because the areas around underneath the I-10 are frequently used by the public. This is historically where they came to meet. This is historically where they're gathered for Mardi Gras, where the Indian gathered, where the brass bands gathered, and they still gather there. So in closing, what I hope I related is that in Louisiana, we really have a culture of compliance that's focused on meeting regulations, really not so much public health. We have this infrastructure disparity that triggers disparate exposures to waterborne hazards and water inaccessibility, and we're not meeting our EJ ideals. What we need is citizen inclusion. We need low-cost autonomous household solutions. We need government transparency and accountability, and we need resources for the future and infrastructure financing options. So I want to acknowledge my partners in crime. From Virginia Tech, Kelsey Piper recently moved to Northeastern in Boston. There's a number of community organizers that I work with in St. Joseph and Enterprise and New Orleans, and Dr. Howard Mielke of lead expertise in Tulane. So at that, I will answer questions.
Thank you, Dr. Katner. Now we'll open it up to the question and answer portion of the talk. So if you have any unaddressed questions that you haven't submitted yet, feel free to do so now. So Dr. Katner, you mentioned how much the media can play a role in actual change occurring in environmental justice settings. Since not all towns can get enough media coverage, how can smaller towns like St. Joseph gain political leverage to overhaul water infrastructure if their own municipality cannot afford it or are too corrupt? And how can engineers play a part in that?
I think that it's very difficult. And I hate to say it, but media sometimes, I couldn't even get media attention on some very high lead levels in the water in New Orleans unless there was a child in the house. And that was one of the first things they would ask me. Is there a child in the house? Well, we want a child. And was the child lead poisoned? And that's what the media is driven by. And unfortunately, the media does help a lot to get attention, political attention on your project. But when you lack it, you need evidence. You need evidence. You need to start with the engineers. You need to start with the scientists who can collect that evidence and then present that evidence before the state legislature or before political people. Or to community advocates. If you can't get any attention from the politicians, try the community advocates. Often you'll find that they are annoying enough that somebody will listen to them eventually. That's one thing you can do. And hopefully through this sort of citizen-centric approach that we're using, we're going to be training a lot of residents on how to engage the politicians, how to engage the advocates. Because a lot of people just don't know. You know, they don't know what a state legislature is. Our education system is so poor here that we really need to start with the basics on how to engage politically.
So going off that, is there a national level organization that is lobbying for drinking water infrastructure, or is all advocacy at this point done on a local scale by normal citizens? And how can this fight for environmental justice become more unified?
One of the groups is the Lead Service Line Replacement Collaborative. So there has been a new lead and copper rule proposed. I'm trying to think if it was released. I know the public comments were out there. Some form of it was released. And a lot of these issues are addressed in the proposed revisions. But some advocates like Earth Justice has contacted me because they will be suing the EPA to make sure that that rule is more protective of the EJ, of the environmental justice community. So there are a lot of national groups. NAACP is involved, Earth Justice is involved, the Environmental Defense Fund is involved. I could go on and on. I'm sure I'm missing some, but you really only have to Google like lead and copper rule advocacy, and you'll see a whole list of people. And the Lead Service Line Collaborative has a list of all the people, all the different advocacy groups that are involved in this. And some of it's at the local level, and some of it's at the national level. So I work with local and I work with national. Locally, I work with the Southern United Neighborhoods, and I work with their Community Voice and Justice and Beyond. And we have worked together to push or pressure the state to pass regulations to require schools to get tested. And they started doing that. The new lead and copper rule will require that. So that's how you get that going.
You mentioned how much education role in community organization and teaching people how to engage politically. How often do utilities fail to comply with industry best practices by giving the public information on how to protect themselves from lead poisoning and other contaminants? And do you think that the 6 fundamental canons of engineers needs to be emphasized more in education to reduce this frequency?
I think that was a 2-part question. I think, you know, when I got into science, we were told don't get involved in politics and, you know, stay arm's length away from the community you're investigating, to be non-biased and all that. And what I learned was that I really wasn't doing much. I'd write a paper and it would go on some dusty shelf in a library and would never get read. And you kind of, I think this generation of scientists, they're crossing that line, they're crossing that barrier, and they're saying, no, I want my science to mean something. I want the community to guide my research. Otherwise, it won't be very meaningful. And in the field of public health, that is wide open. That is really what should be spurring, in many ways, some of the research in my field and in engineering as well. And I do think that ethics is important, is critical. I reflect on ethics continually when I have to make a decision. You know, do I come out with this? Do I say this to the public? Do I keep it to myself? What is the ethical way of releasing this information without violating, you know, any kind of privacy requirements? So I constantly face those ethical questions in my field, and I don't think you'll ever stop. And that's why I think having those principal, you know, foundations is a good way to guide you along that road, because they're going to keep coming up. No matter what field you go into, you're going to face them.
As a researcher/engineer, is it hard for you to keep your motivation for researching water quality when the government and elected officials ignore or blatantly hide the scientific proof backing your claims?
You know, I'm facing that issue now, but in relation to air quality. So I'm working with the community. We have exceedances in air quality levels. We have biomonitoring to prove exposure. We have associated increases, significant increases in associated health impacts. And yet there's still a scientific question about whether these air emissions are directly related to these health impacts. It's almost like climate change denial. As long as there's one scientist that you can buy, or one politician that you can buy, or someone that can cast doubt on the science, you're always going to be questioned about it. And it is very frustrating. It is. And that's why scientists have to stand up with each other. When we see one of our own getting pushed down by politicians, getting pushed down by deniers, getting pushed down, we have to stand up with them. And stay on your lane. So you don't want to like become an expert in something and talk about something else. That's one of the components, is make sure you're talking about something you know about. But come to their defense if you know that it's right and you know what others are doing is wrong. It's critical. And I think your generation is doing that. You're getting involved in these issues and you're coming together.
Yeah, I agree. Scientists need to use their voice more and acknowledge the fact that problems not only solved analytically, but an interdisciplinary approach has to be taken a lot of the time.
Yeah, the problems of tomorrow are too complex. That's one of the things that our lesson plans are built on, interdisciplinarity. We have to have social scientists working with engineers. The whole thing in Flint happened because the public health practitioners didn't talk to the water quality engineers, who didn't talk to the regulators. We need to work together, and we need to be somewhat knowledgeable about all of these fields. We need to have interdisciplinary education so that we can communicate with each other.
So we have one more question. How widespread is point of use treatment in Northern Louisiana? And do you think relying on point of use treatment is a just way to provide safe water for everyone?
No, it's not going to fix every problem. So there are towns like St. Joseph and Enterprise where there's too much particulate, and you're going to need water softening or other some other kind of water treatment systems. So we're constantly looking at ways to address high particulates in water, because we really can't do them with the point of use filters, the low cost ones that we have out there. So it's not a perfect solution. And one of the things we're trying to do is say, okay, well, under these conditions, this filter works really well. But when you have these conditions, you need to do this first before you implement that. And it's not perfect, but it's the best we can do right now. And the key is low cost. Low cost. Because these people are $15,000 a year. That's very little.
Okay, so unfortunately, that's all we have time for today. I'd once again like to thank Dr. Katner for making time in her busy schedule to participate in our 2020 Environmental Justice Speaker Series, even though she won't be able to get the wonderful in-person round of applause that she deserves. I also want to extend a thank you to the viewers who joined the talk today for showing that you care about environmental justice issues. People like you all give me hope that together we can make it through these increasingly turbulent times together. For our next meeting, we are extremely excited to host Michelle Gabrieloff Parrish, Michaela Ironshell Dominguez, and Fatuma Ahmad, 3 women of color who are experts in permaculture, indigenous youth justice, and sustainable food distribution. So don't forget to join us on November 10th at the same time to learn how to resist environmental injustice through education.
Thank you guys. Thanks for having me.